On your phone. Si vous désirez poser une question, appuyez sur étoile 1. Procédons à la séance d'information technique. Let's begin today's technical briefing. Over to you, Dr. Sharma.
Thank you, merci, Eric. Good morning, good afternoon, everyone. Thank you for joining us. Today, I'm here to talk to you about Health Canada's authorization of Pfizer-BioNTech's COVID-19 vaccine in children 12 to 15 years of age. This is the first vaccine authorized in Canada for the prevention of COVID-19 in children and marks a significant milestone in Canada's fight against the pandemic. Health Canada received Pfizer-BioNTech's submission for this expanded indication on April 16th. After completing a thorough and independent scientific review of the evidence, the department determined that this vaccine is safe and effective when used in this younger age group. Health Canada's assessment built upon the previous review of the Pfizer-BioNTech vaccine, where data on both the early studies that were part of the development of the vaccine as well as manufacturing information had already been examined. Scientists reviewed data from an extension of the original large phase 3 study conducted in adults, which included over 2,000 participants between 12 and 15 years of age. The study used the same 2-dose regimen and the same dose of vaccine that has been authorized for use in adults. Participants in the 12 to 5-year age group were all enrolled at sites in the United States. The trial also compared the immune response in this age group and its safety profile to a group of young adults 16 to 25 years of age already participating in the study. Data from the clinical trial showed that the vaccine's efficacy after the second dose in preventing COVID-19 in this younger age group was 100%. There were over 1,000 people in each of the two groups, one that did not receive the vaccine and one that did. In the group that did not receive the vaccine, there were 18 cases of COVID-19, and in the group that received the vaccine, there were 0. The efficacy was also further supported by antibody levels measured in a smaller group of the 12 and 15-year-olds that were comparable to the levels seen in young adults. The safety profile of the Pfizer-BioNTech vaccine in 12 to 15-year-olds is similar to what we saw for older people. That is, the most commonly reported side effects were temporary and mild, like a sore arm, chills, or fever. Health Canada applied its science and evidence-based review process and required that the same high standards were met as with all our vaccine reviews. We also know that millions of people have received the Pfizer vaccine and no new safety issues have been identified. As with all of the vaccines authorized under the interim order, Health Canada has placed terms and conditions on this authorization. These require Pfizer-BioNTech to provide additional information to Health Canada on the safety, efficacy, and quality of the vaccine to ensure that the benefits continue to outweigh its risks as it is given to more people. Health Canada and the Public Health Agency work together with the provinces and territories, as well as the manufacturer and regulators around the world, to constantly monitor the safety of vaccines. We know that the system works to quickly identify even the very rare and unexpected side effects. Although this is the first vaccine authorized for children, other manufacturers of the vaccines authorized in Canada are conducting or planning studies in adolescents and younger children, including children from 6 months to 11 years of age. As soon as we receive these submissions, Health Canada will expedite their review. Since the beginning of the pandemic, approximately 20% of cases of COVID-19 in Canada have been reported in people under the age of 19. While younger people are less likely to experience serious cases of COVID-19, having access to a safe and effective vaccine will help control the disease's spread to their families and friends, some of whom may be at higher risk of complications. It'll also support the return to a more normal life for our children, who have had such a hard time over the past year. In keeping with our commitment to openness and transparency, Health Canada is publishing multiple documents related to this decision, including a revised Canadian product monograph and a high-level summary of the evidence that we reviewed. All of this information can be found at covid-vaccine.canada.ca. Now that we have millions of safe and effective vaccines rolling out across the country, I'm sure people will want to know more about when they will be available, especially for this age group. Our colleagues at the Public Health Agency of Canada will be holding their weekly technical briefing on rollout logistics tomorrow, where they can take some of those questions. Today's authorization is very good news, and we are starting to see the light at the end of the tunnel, but until the majority of Canadians are vaccinated, we need to continue to be diligent about following public health guidelines. That means keeping our physical distance, continuing to wear a mask, and washing our hands. Thank you.
Bonjour. Merci. Good morning. Thank you for joining us today. I'm here to talk to you about Health Canada's authorization of Pfizer-BioNTech's COVID-19 vaccine in children 12 to 15 years of age. This is the first vaccine authorized in Canada for the prevention of COVID-19 in children and marks a significant milestone in Canada's fight against the pandemic. Health Canada received Pfizer-BioNTech's submission for this expanded indication on April 16th. After completing a thorough and independent scientific review of the evidence, the department determined that this vaccine is safe and effective when used in this younger age group. Health Canada's assessment built upon the previous review of the Pfizer-BioNTech vaccine, where data on both the early studies that were part of the development of the vaccine as well as manufacturing information had already been examined. Scientists reviewed data from an extension of the original large phase 3 study conducted in adults, which included over 2,000 participants between 12 and 15 years of age. The study used the same two-dose regimen and the same dose of vaccine that has been authorized for use in adults. Participants in the 12 to 15-year age group were all enrolled at sites in the United States. The trial also compared the immune response in this age group and its safety profile to a group of young adults 16 to 25 years of age already participating in the study. Data from the clinical trial showed that the vaccine's efficacy after the second dose in preventing COVID-19 in this younger age group was 100%. There were over 1,000 people in each of two groups, one that did not receive the vaccine and one that did. In the group that did not receive the vaccine, there were 18 cases of COVID-19, and in the group that received the vaccine, there were 0. The efficacy was also further supported by antibody levels measured in a smaller group of the 12 to 15-year-olds that were comparable to the levels seen in young adults. The safety profile of the Pfizer-BioNTech vaccine in 12 to 15-year-olds is similar to what we saw for older people. That is, the most commonly reported side effects were temporary and mild, like a sore arm, chills, or fever. Health Canada applied its science and evidence-based review process and required that the same high standards were met as with all other vaccine reviews. We also know that millions of people have received the Pfizer vaccine and no new safety issues have been identified. As with all of the vaccines authorized under the interim order, Health Canada has placed terms and conditions on this authorization. These require Pfizer-BioNTech to provide additional information to Health Canada on the safety, efficacy, and quality of the vaccine to ensure its benefits continue to outweigh its risks as it is given to more people. Health Canada and the Public Health Agency work together with the provinces and territories as well as the manufacturer and regulators around the world to constantly monitor the safety of vaccines. We know that the system works to quickly identify even very rare and unexpected side effects. Although this is the first vaccine authorized for children, other manufacturers of the vaccines authorized in Canada are conducting or planning studies in adolescents and younger children, including children from 6 months to 11 years of age. As soon as we receive the submissions, Health Canada will expedite their review. Since the beginning of the pandemic, approximately 20% of cases of COVID-19 in Canada have been reported in people under the age of 19. While younger people are less likely to experience serious cases of COVID-19, having access to a safe and effective vaccine will help to control the disease's spread to their families and friends, some of whom may be at a higher risk of complications. It will also support the return to a more normal life for our children who have had such a hard time over the past year. In keeping with our commitment to openness and transparency, Health Canada is publishing multiple documents related to this decision, including a revised product monograph and a high-level summary of the evidence we reviewed. All this information can be found at covidvaccine.canada.ca. Now that we have millions of safe and effective vaccines rolling out across the country, I'm sure people want to know more about when they will be available. Our colleagues at the Public Health Agency of Canada will be holding their weekly technical briefing on rollout and logistics tomorrow, where they can take some of these questions. Today's authorization is very good news, and we are starting to see the light at the end of the tunnel. But until the majority of Canadians are vaccinated, we need to continue to be diligent about following public health guidelines. That means keeping our physical distance, continuing to wear a mask, and washing our hands. Thank you.
Merci, Dr. Bertion.
Thank you.
To questions, please remember that we are taking questions in both official languages, and we ask that you limit yourself to one question and only one follow-up. Nous vous demandons de vous limiter à une question et une question suivie, et vous pouvez poser vos questions dans l'une des deux langues officielles. Donc, nous commençons la période de questions. Opérateur, over to you.
Thank you. Merci. S'il vous plaît, appuyez sur l'étoile 1 maintenant pour poser une question. Please press star 1 at this time to ask a question. Et la première question est de Raymond Filion.
First question, Raymond Filion, TVA. You have the floor. Thank you. Good morning. Clarification. You said Pfizer has to provide additional information to Health Canada on safety. Should we take it that the vaccine can now be administered right here in Canada, or should we wait? Answer. The authorization is effective as of now, so it's possible to administer the Pfizer vaccine in Canada to adolescents 12 to 15 years old as of now. Question, I would like to hear you about the recent confusion. According to Health Canada, is it better for people to be patient and receive an mRNA vaccine, or is it preferable to receive a viral vector vaccine if that's the one that's available to them? Answer, Health Canada has authorized 4 vaccines for local use against COVID-19. As you know, there are 2 mRNA vaccines and 2 other ones, AstraZeneca and Janssen. The viral vector AstraZeneca and Janssen vaccine have some very rare secondary side effects, thrombosis with low platelets. These are very rare side effects that have been reported, and these happen at a frequency of about 1 out of 100,000. So from the databases we have in the EU and Europe, people are informed. The information has been communicated in the product monograph. It's true that the mRNA vaccine have not had similar side effects, but at the same time, let's bear in mind that the vaccines are there to help fight COVID-19, and the risk of contracting COVID-19 is still very present in many parts of the country. Delaying vaccination also entails some risks. Of course, we can look at the risk of various vaccines and compare the risks, but what we need to look at is the risk of waiting 8 weeks or more to be vaccinated, bearing in mind that when we are vaccinated, it takes 3 to 4 weeks for us to develop effective immunity against the disease. Looking at the rate of transmission, all available vaccines should be considered as options that have benefits that outweigh the risks when it comes to the fight against COVID-19. I know that 56 deaths, lots of people have died. 330,000 Canadians have died. 330 Canadians have died, and this remains a risk we need to take into account this issue. So if you are offered a vaccine that will protect you, your family, and your community, Canadians should look into all the options that are available to them. Thank you, Dr. Bertion.
Merci, thank you. The next question is from Mia Rabson of the Canadian Press. Please go ahead, your line is open.
Hi there. I'm wondering if you could talk a little bit about what this might mean for schools reopening and what we know about the application or the chances that kids younger than 12 will have the vaccine approved anytime soon.
Thanks, Mia, for the question. So I'll answer the second part of that first. So for Pfizer does have ongoing trials in younger age groups as well. They've signaled that they may be giving Health Canada a submission for the younger age groups, so 5 to 11, as soon as September. So we'll have to wait to see what the timing of that would be. And then, of course, as with all the reviews, we would have to go through the data to see if it actually meets the standards of being authorized. We know that Moderna also has clinical trials underway for those same age groups. And again, we don't have specific timing on when we would receive those submissions, but we may be getting those in the next few months. So that's just on the timing for the younger age groups. And then, the role of Health Canada is to really look at these vaccines to see if they meet those standards for use, so that they can be approved, that the benefits outweigh the risks. And the use of those vaccines really is dependent on the provinces and territories that need to look at their own demographics, their priority groups, and how they use the supply. So it really would depend on the provinces and territories about when the availability would be there for the younger age groups, and then what implications that would have with respect to school opening. Just to say, though, that we do know that COVID is milder and less frequent in children, but it is not zero. We have had cases, tragically, of young children and teens that have died as a result of COVID-19. There's also other syndromes, inflammatory syndromes that are rare but can be associated with even mild infection. And we're also seeing, we're getting more and more information about vaccine's ability to also block transmission. And so, it's not just the individuals that get vaccinated or that might help, but also, prevent that transmission to potentially other people in the family and in the community. So schools, I think, are one part of it, but there's also the overall benefits and risks of vaccines and vaccination in younger age groups as well to consider.
Vaccines and whether people should wait. I know that Dr. Berthiaume was just discussing that, but do you think that there are preferred vaccines? Do you think the mRNA vaccines are better? And do you think that if someone is at low risk of getting COVID, they should wait to get an mRNA vaccine?
Right. So, first of all, the decision to be vaccinated and when to be vaccinated is a deeply personal one. So our role at the federal level, whether it's Health Canada or anywhere else, is to really provide accurate and consistent information for people to make those decisions. And so in order to do that, I think it's helpful just to step back a little bit and say that, when we're looking at these vaccines, we have 4 vaccines that have been authorized by Health Canada, 3 of which are in use in Canada at this time. And we've always said that it's difficult to compare them. So in terms of their effectiveness, you can't really compare one vaccine to another without doing a clinical trial, which we call a head-to-head trial. But we do know that all of the vaccines are very effective at preventing COVID-19 where it matters most, and that's in patients and people that have, prevention of severe disease, hospitalization, and death. So on the effectiveness side, we know that all of the vaccines do a very, very good job in that sort of prevention. We also know that for the viral vector vaccine, so for AstraZeneca and the Johnson & Johnson vaccine, that there is this extremely rare risk of these clotting events. Now, I don't want to minimize those. They are real, but we have to put that in context. Those are rare, and we can diagnose those conditions, and we can treat them. But that's something that needs to be taken into consideration as well, and those are on the benefits and the risk side. The other part that's very important is the context. So depending on where you are, in most parts of Canada, we're in the midst of the third wave. So the incidence of COVID-19 is high in a lot of places, in the vast majority of places. So we actually have to look not only at the risks and benefits of vaccination, but the risks and benefits of not being vaccinated. And so, if you have the choice in front of you and you've got 2 vaccines, absolutely, there may be an advantage to choosing an mRNA vaccine because of this avoidance of this rare risk. But in a lot of cases, you may not have that ability. So you have to really weigh the risk of getting vaccinated now with the vaccine. And again, those vaccines are very good in terms of prevention of serious illness and death versus the risk of potentially getting COVID-19. And as Dr. Berthiaume mentioned when he responded to the question, yesterday alone we had 56 individuals tragically lost to COVID-19 in Canada. So the reason that I'm going through all of this is because all of this is important in people making those decisions. You have to look at the benefits, you have to look at the risks, and you have to look at the context. So even in areas where the risk is low and you think that you are not at a high risk of going out, if you're homebound, for example, we also know that that risk can change very quickly. So the risk of COVID-19 in the community. And we know that when you get the vaccine, your immunity doesn't start right away. It takes about 3 to 4 weeks to develop. So what we're saying is that you have to look at all of those things when you're making your decision. But again, when we're talking about the effectiveness of these vaccines, they're all very, very effective. What I say is that if your life is in danger and you need to call 911 to get help to save your life, it does not matter if that call is made on an iPhone or a Samsung or even a flip phone. It does what it is supposed to do. So I think, we really need to equip Canadians with as much information so that they can take those into consideration when they're making their decisions about vaccination and getting vaccinated. And we know that vaccination is such a key tool for us in this fight against COVID-19 and getting us closer to some sense of normality that we're missing so much.
Thank you, Dr. Sharma. We'll move to the next question. Prochaine question, opérateur.
Thank you, merci. La prochaine question est de Boris Prou, Le Devoir.
Next question, Boris Prou, Le Devoir. Good morning. I've just heard the answer given before, and I understand that has been your line from the very beginning. Even if the risk of COVID is low in some regions, things can change very quickly. But that's not what we heard yesterday from the Public Health Agency of Canada, which was following the advice of local public health authorities, saying that in some regions, the calculations may be different when looking at the choice of preferred vaccine. I would like to know if you have any ideas about it. Are you working as a team with the Public Health Agency of Canada? Is there a single message that we could receive from all the various public health agencies? Answer: of course, we work in collaboration with the Public Health Agency of Canada, which works in collaboration with the various public health agencies in the provinces and territories. What we need to understand is that Health Canada and the Public Health Agency and the provincial authorities have different and complementary roles. Health Canada's role is to approve and make available safe and effective products to the provinces and territories. And that is what has been done. 4 vaccines are now available. There's a National Consult Advisory Committee on Immunization that also provides advice to the federal and provincial authorities. Ultimately, it's the provinces that decide on the vaccine portfolio that they choose depending on needs and COVID risks within specific populations and age groups. How should those vaccines be optimized? Health Canada makes available vaccines. We will continue saying that all available vaccines are safe and effective. Of course, they have specific properties, but ultimately they are all excellent vaccines. And then the provinces may decide how those vaccines should be rolled out on their territories. Of course, individually, there's different information that has circulated. Sometimes it may be difficult to know what people should do. The best thing is to rely on the decisions that are taken at the level of each province and territory. If they are confused, they could talk to their pharmacists or doctors so that the benefits and risks of a specific product can be explained. For Health Canada, these are products that offer more benefits than risks, and they are available. When we look at the risk of contracting COVID-19 versus the risk of taking those products, these are very rare risks when compared to complications that may lead to hospitalization or long COVID. So taking into account all these, All these vaccines, including viral vector vaccines, are very useful in Canada to help us fight COVID-19. But now, if there's a place where there's a very low number of cases, other vaccines may be given priority, but the provinces have the prerogative to do that. Follow-up question. Studies have been done to authorize other types of vaccines for young children. You're talking about children 6 months to 11 years. Could you please tell us what is being studied by Health Canada for use in children right now? Answer. Health Canada is working with vaccine manufacturers to find out when data can be provided. Right now, the Pfizer one has been approved for children between 12 to 15. They're also working on something for children who are younger, and results should be available soon. And there will also be a study for those between 6 months to 5 years, but we do not have a specific calendar or schedule for obtaining those results. As for the Moderna vaccine, another mRNA vaccine, studies are underway for use in children between 12 to 15 years. So we will be receiving results soon. There will also be studies for those between 6 months to 12 years, but results should be expected by 2023. There have been some clinical studies on other vaccines, Johnson & Johnson, that has been placed on pause right now. But for vaccines for which studies are undergoing, and these are Pfizer and Moderna vaccines. Thank you, Dr. Berthiaume. Next question.
Next question is from Mike Lécouteur of Global News. Please go ahead.
Good morning. Thanks for taking our questions. I just wanted to know if you can say what kind of an impact this will have on the percentage of Canadians, how many more Canadians will be eligible for vaccines. And now that we are looking at getting adolescents vaccinated, how do those numbers bring us closer to a possible herd immunity?
Dr. Sharma, you're on mute, I think.
Thank you. I clicked it. So with respect to herd immunity, I think, every vaccination that we have gets us closer to having a greater percentage of the population vaccinated. Certainly, if we just look at the adult population, we are relying on people to step up and get vaccinated as soon as possible. And that is really the bulk of the individuals in Canada. The estimates for the ages of 12 to 15 in terms of the population, I don't have those with me at the moment. But they are, I think, Dr. Berthiaume, I'm not sure if we have them as well, but they are closer to, they're obviously smaller numbers. But again, those are important because of, as we said, potential risks for themselves and for transmission, and then, of course, back into other activities and schools. So, it's important to focus on all the different populations. And again, the more people that are vaccinated, the closer we get to potentially, stopping the transmission of the vaccine. It's not just on the numbers of people that are transmitted. It's, of course, also on the numbers of cases of COVID that we have. And then that also, really calls to the importance of the public health measures that we have as well.
Just as a follow-up, I wanted to know, because we were hearing reports that Canada is apparently conducting its own study about vaccine mixing with results expected next week. Do you have any more details on that? Who's part of the study? How big it is?
Right. So we right now we don't have any trials in Canada for vaccine mixing. And so vaccine mixing would be one type of vaccine for the first dose and another type for the second dose. For the ones that we have authorized and in development, that would most likely be an mRNA vaccine like a Pfizer and Moderna combined with an AstraZeneca, which is like a viral vector vaccine. So we have heard that there is a site in Canada that is looking towards potentially starting that clinical trial, but that submission for that mixed dose schedule has not yet been received. So as soon as we receive it, we will review it and authorize it if it does meet the criteria. We do know that in the United Kingdom, there is a trial that's ongoing involving this type of mechanism, so mixing the schedules, and very anxious to see the results of that, which we expect to be coming out in the next month or so.
Thank you, Dr. Charmant. Prochaine question, opérateur.
Merci, thank you. La prochaine question est de Catherine Lévesque.
Next question. La presse canadienne, Catherine Lévesque. Thank you. Good morning to you too. I have a question about the Janssen vaccine. How far has Health Canada gone with the 300 doses that were withheld last week? What is Health Canada's position on that? Answer. The Janssen, the 300,000 doses now in Canada are being analyzed and investigated by Health Canada. We're looking into the manufacturing, the active ingredients that were used in manufacturing these lots of vaccines. As you know, the active ingredient came from a factory in Maryland where the AstraZeneca vaccine and the Johnson vaccines were both being manufactured. So we are studying the integrity of the processes, the quality of the product. So we've asked for data from the manufacturers, which we are now analyzing. We should be getting recommendations in the coming days. And from then, we will take a decision on what should happen to those vaccines that are now in Canada. We are working hard on that. Of course, let me clarify that these vaccines would not be distributed in Canada for as long as there's any doubt still reigning on that consignment of vaccines. Thank you. Follow-up question. Let me come back to the recommendation. I know many of my colleagues asked a question on that already. We would like to know, and maybe you can clarify, is Health Canada ready to say today to people to take the first vaccine that is offered, even if it is Samsung or the last iPhone? Because that's the recommendation we've been hearing over the past few weeks and months. It's the same message you have today. Answer. I think our message today is that there are 4 vaccines available. 3 of them are being distributed. All are vaccines that offer real benefits to prevent COVID-19. I think people need to get informed, ask their own questions about the various COVID vaccines, and then take a decision. The decision they take should take into account not only the risks, but also the risk of contaminating loved ones and the community. Let's take, for example, Great Britain, where there were 22 million doses of the AstraZeneca vaccine distributed. This enabled them control the situation of the pandemic. We have the British variant was very prevalent in Great Britain, and the AstraZeneca vaccine helped them to prevent the spread of that vaccine. The AstraZeneca vaccine enabled Great Britain to reopen some of its activities and to get back to a somewhat normal life. The same thing applies to Canada. Collectively, there are great benefits to vaccination, irrespective of the type of vaccine we choose from amongst the 3 or 4 available in Canada. It becomes a matter of individual choice. People should understand that, well, if they are waiting for an mRNA vaccine instead of taking the AstraZeneca vaccine, there's a risk of getting COVID-19. So let's not only compare the risk between the vaccines, we need to look at the risk of taking the vaccine or the risk of waiting for another vaccine. And as we said, it takes 3 to 4 weeks before we develop full immunity from the vaccine. So what I'll tell people is that any vaccine is better than none. If you have any concerns, discuss them with your healthcare professional. But overall, for most regions in Canada, the AstraZeneca vaccine is offering more benefits than risks when it comes to protecting people and the community against COVID-19.
Merci beaucoup.
Thank you. Next question.
The next question is from Annie Bergeron-Oliver of CTV National News. Please go ahead.
Hi, sorry to go back on this, but my question is for Dr. Sharma. On April 14th, you were quoted as saying, get whatever vaccine is available to you. It's that simple. The longer you wait to get vaccinated, the longer you're not protected. Why has that message changed?
So that, from our perspective, I don't think that message has changed. So what we're saying is that by the time you have a vaccine offered to you, it has already gone through Health Canada review. So, and we've determined that it can be used in Canada, that it's safe and effective for the population that we've approved it for. We have the recommendations from NACI. We have the provinces and territories that have received their allocation, their supply of vaccines. They've looked at their demographics in their province and territory. They've looked at what's happening with COVID-19 there, and they've made decisions about which populations should be prioritized, who should be offered what vaccine. So, you know, if a vaccine is offered to you, it is a good option. And we're always looking at the benefits of a vaccine compared to the risks of that vaccine, but also you have to look at what would happen if you don't get vaccinated. So the benefits and risks of not getting vaccinated or of waiting for another vaccine. So that's always been the case. We've always said we have to weigh those benefits and risks. We now have more information about the vaccines. We have more information about the benefits, about the real world benefits from the vaccines. So AstraZeneca, for example, is a vaccine that's been used widely in the UK and has really been, you know, one of the key reasons that they have their pandemic under control and are starting to open up. So we know that they're effective at controlling COVID-19. There are risks associated with them as well, especially with the viral vector vaccines that we have to take into consideration. But those are very small. They're very real. They can be serious, but they're very small. And so we always have to weigh those risks against the risks of potentially getting COVID-19. So, you know, we still say that if you, you know, your best choice is to protect yourselves by getting vaccinated, by protecting, that helps protect your family, your community. It helps us get to a place where we will have a, you know, more control over COVID-19. And so when you're offered a vaccine, then that is a really, really good option. What now we're also saying is that if you have that option in front of you, and you have to also take into consideration that context, you know, where are you in the country? How much COVID-19 is there? What is your personal risk? And you have to weigh that decision, and you have to be comfortable with that decision. We don't want to force anyone to get vaccinated at a certain time. We don't want to make those decisions for them. What we're saying is that you need to have as much information at your disposal to be able to feel comfortable with the decision that you're making. So for people that have taken the AstraZeneca vaccine, I want to say thank you to them, because they've taken steps to protect themselves, to protect their families, and to protect the community, being aware of the potential risks as well. We have 4 vaccines authorized in Canada, 3 that are being used. They are all very, very effective in combating COVID-19, serious infections, hospitalizations, and deaths.
Thank you for that answer. My follow-up is sort of a 2-part question. One, what exactly is the risk right now for AstraZeneca and the VITT? And the second part is, that there are at least 1.7 million Canadians who have now received one dose of AstraZeneca. We talk a lot about the risks associated with the rare blood clots after the first dose, but these 1.7 million Canadians now have to get a second dose in the coming week. So what is the risk as well after a second dose? Is it the same? And can you provide any context on that second dose risk for people who are waiting to get their second AstraZeneca shot?
Right. So in terms of the risk of this vaccine-induced thrombocytopenia, so related to the vaccine, unusual blood clots, very rare, associated with low platelets. The estimates of risk that we have, and this is based on international information, especially from the UK, when they've delivered 22 million doses, is that we have an estimated risk of about 1 in 100,000. And that changes as we have more information, but that has been pretty steady at about 1 in 100,000 for the last while. So, and in terms of deaths due to VIT, the estimates that we're using is approximately 20% of the cases may result in deaths. But what's really important to note about these is that it's something that can be diagnosed and can be treated. So for people that have had AstraZeneca, if you are in that time period, so 4 days to 28 days, there are symptoms that you can make sure that you're watching out for. And if you have those symptoms, we're encouraging people to make sure that they get seen so that if they do have this rare event, they can be diagnosed and treated. We have less information about second doses. So again, from the UK, we have about 22 million doses that have been delivered, but we have only about 1.1 million doses of second doses that have been delivered for AstraZeneca and been administered. And out of those 4.4 million doses, there have been 4 cases of VIT. So 4 cases of VIT with second doses on 4.4 million doses, so about 1 in a million. But again, that's the information that we have from the UK. So what we're saying now is with respect to AstraZeneca, we still say that if you've had 1 dose of AstraZeneca, unless you have had this very rare clotting event, or if you had an allergic reaction to it, then you would go ahead and get your second dose of AstraZeneca. But we also are aware that there are trials going on looking at potentially mixed doses. So 1 dose of a viral vector vaccine and 1 dose of mRNA. So what I would say for people that have had 1 dose of AstraZeneca, that plan to get your second dose when that is available, but stay tuned for information from other clinical trials that might change those recommendations if we get information to say that you might even have a better immune response and no increased risk on the safety side from those studies that are ongoing.
Thank you, Dr. Sharma. Opérateur, prochaine question.
Thank you, merci. La prochaine question est de Laurence Martin.
Next question, Laurence Martin, Radio-Canada. Good morning, Dr. Bertion. Let me come back to AstraZeneca to seek clarification. In regions where there's no high transmission rate, in your opinion, according to Health Canada, should people wait for the Pfizer or Moderna vaccine instead of taking AstraZeneca? Answer. Your question is, in a region where there's a low transmission rate, is AstraZeneca a good choice? It's not a bad choice. It should be considered. We can say that the AstraZeneca vaccine, I don't think we can say that the AstraZeneca vaccine should be put aside. People have a choice to make. Should they take the AstraZeneca vaccine and be protected right away or wait for a while to receive another vaccine? Let me remind you that there are various situations in Canada. Some communities that were almost spared by COVID-19 within 2 to 3 weeks found themselves with a COVID outbreak. And once there's an outbreak, if the vaccination rate is low in a community, the vaccine could be widely transmitted. And for people to develop immunity, it could take 4 to 6 weeks, and COVID would have had time to make people very sick and cause other sorts of damage. The fact that there's no COVID in a community or region is no guarantee that there will be no outbreak in the coming weeks. So the AstraZeneca vaccine remains a good option. Now, our role is to approve products, make information available. It's up to people to take their own decisions, so long as it's an informed decision. In our opinion, it's not a bad decision to consider the AstraZeneca vaccine, even in situations where the COVID rate is low. People should take informed decision. Let me clarify the context. We are talking of one case out of 100,000 cases where we have thrombosis associated with low platelets. So the risk is 1 out of 100,000. Now, the risk of dying from a car accident is 25 times that. Many people die from car accidents every year. So if we compare that, so there's a 25% lower chance of dying from the AstraZeneca vaccine than dying from a car accident in Canada. So we need to look at the risks. When we take the risk in isolation, it seems horrible because people think they may die. But if everything is compared to other risks that we are exposed to every day, well, the risk of COVID-19 has a lot of unforeseens when it comes to what may happen in the coming weeks in communities where there's no high rate of transmission now. So, as I said, the AstraZeneca vaccine option is still a good one. I told you that in Great Britain, it was widely used in the country, 20 million doses, and this helped them to control the COVID-19 pandemic, and they were able to go back to normal life. Follow-up. I know your colleague talked about it in English, but I would like you to come back to that. The issue of the second dose, particularly for those who received the first AstraZeneca vaccine dose. Do you think it's risky for them to go take a second AstraZeneca dose, or should they take another vaccine as a second dose? What's your opinion? Answer. The data we have is limited when it comes to the adverse events associated with second use of the AstraZeneca vaccine. Looking at the database that was prepared in Great Britain and the EU, the adverse events, the rate of blood clot is about 1 out of 1 million. People had severe side effects after the first dose. Those who had severe side effects should not consider taking the second dose. But if they did not have any serious side effects after taking the first dose, then the second dose should be considered. As I said before, the risk remains, but it doesn't seem to be higher when people take the second dose. The benefit of the second dose is that it ensures long-term immunity, particularly since for the AstraZeneca vaccine, we have excellent long-term immunity if the second dose is taken 12 weeks after the first. So when you look at the protection it offers against COVID-19, it is important. So we need to take this into account. So this second dose AstraZeneca vaccine will give people a longer-term protection, and there's a lower risk of adverse events and will help people fight COVID-19. So it remains an option to be considered, of course. Thank you, Dr. Bethion.
Question opérateur.
Merci, thank you. And the last question is from Tonda McCharles of the Toronto Star. Please go ahead. Your line is open.
Hi, Dr. Sharma, it seems to me that Health Canada is the first regulatory authority to approve the 12 to 15-year-old cohort for Pfizer. Is that correct, or has another authority actually approved it to date? And can you give us a detail actually on when did you approve it? It was in the last 24 hours, and when you actually expect it to be made available to that age group?
So yes, from our understanding, we're the first in the world to authorize Pfizer for ages 12 to 15. The US FDA also has the same submission under review, as does the UK MHRA, and the European Medicines Agency will be reviewing it as well. So yes, we are the first. And basically with the authorization, it now can be used for this age group. So there's nothing else that needs to be done for it to be used. It is the same dose. So it's the same vaccine, it's the same dose, and it's the same dosing regimen as is already authorized for adults. So that can happen at any point in time. Just to note also that, there are some provinces that have already provided some vaccine to this age group if they were children that were at high risk. So that was done off-label, which is absolutely within their purview. So we do have some children in Canada that have already received a vaccine dose, but basically the authorization was signed off this morning, and that was when it's officially authorized, and all of the information is available on the website with respect to the information that we looked at. There's what we call a regulatory decision summary that we published that outlines at a high level the evidence that we looked at and the decision that was made. So all of that's publicly available, along with the Canadian product monograph that has information for healthcare practitioners and for Canadians around everything that goes into the indications and the warnings, the information that we've looked at as well. So that's all available.
Thanks. And I'm curious to get an update from you on Novavax, which you have not mentioned of late. So that was supposed to, I think you were expecting information on that last month. But if you could just give me a line on the Novavax update, but I just, on everything you've been asked here today and all the confusing messaging that we've been hearing over the last couple of days from various medical advisors to and within the government, I haven't heard anyone say that if there's such, if the mRNA vaccines are better, they don't have that low risk you're talking about of the blood clot, then why aren't none of you recommending them and prioritizing them for essential workers in high-risk communities? Why are you telling them you should take the crappy vaccine sooner instead of taking the gold standard vaccine that you suggest is out there?
So the first part on Novavax. So Novavax, we have two vaccines currently under review. One is the Novavax vaccine, and the other one is the Medicago vaccine. For Novavax, you're right, we were expecting some clinical trial information to come in as early as at the end of last month or early this month, but we were notified by Novavax that there were some delays in providing the clinical trial information. So we are maybe expecting that by the end of May or early June, but it really depends on when they finish assessing the trials and they're ready to submit. In addition, for Novavax, there's still significant manufacturing information that we've not yet received. So we've received a lot of the preclinical information, the laboratory piece. There's still significant amounts of clinical information that we're expecting to receive, and on the manufacturing side. So it really will depend on the data. And then with respect to the use of the vaccines and how they are distributed and rolled out, each vaccine will have its advantages and disadvantages. One of the advantages of the viral vector vaccine is its ability to be stored in refrigerator temperatures, so it doesn't have to be frozen. With the Johnson & Johnson vaccine that we haven't yet distributed, it is a one-dose vaccine, so that might be used for certain populations where it's difficult to administer the second dose. So you really have to look at all of those considerations, and that's what the provinces and territories look at when they are deciding where to offer what vaccines. Now, we know that for the mRNA vaccines, part of the challenges around the distribution was the temperature at which they have to be stored. We have been told by Pfizer that we're expecting additional information to be able to lower that time in terms of, increase the time at lower temperature that they can be stored. So that might give us some flexibility as well. But it really depends on which vaccines that you have, which populations are most at risk of getting COVID-19, so having the infection, and which ones are at most risk for being seriously ill with COVID-19. And that's really how the prioritization should be looked at. We know that in Canada, when we're looking at the volumes of vaccines that are coming in, certainly the Pfizer vaccine is the one that is really going to be the backbone for the immunization programs here in Canada, just because it's the most volume. So, you have to look at the supply, you have to look at what you know about the vaccines, what the characteristics are about the vaccines, and then the provinces and territories and the local regional health authorities need to see how they can both best get them administered. And, the overall goal is the same, regardless of where we are, is to get as many people vaccinated as soon as possible. And that's what will serve us best as individuals, as families, as communities, and as a country.
Thank you, Dr. Sharma. That will be all for today's technical briefing. C'est ce qui met fin au briefing technique pour aujourd'hui. Bonne journée.